Thank you for inviting me to be here. I am an HIV clinician, as I said earlier, and actually started caring for patients with HIV in the mid-'80s. And as has been stated, that was a time where HIV was a death sentence, and it was a death sentence with no appeal. It has been remarkable in my career to see the changes that have occurred in our ability to care for HIV-infected people and how well that they now do. We had the introduction of very good medications starting in the late 80s, and in the mid-90s there was literally a sea change in our ability to care for HIV infection. That sea change has essentially continued. The drugs that we have today to treat HIV infection are quite remarkable. I can look in the eye of a 25-year-old patient, for example, now, who presents to me with HIV infection, and tell them that with taking the medications that we have now, with continued good access to medical care of all kinds over their lifespan, in fact, 50 years from now, they're still going to be living. And that's supported actually by some very good data from Europe and actually recently published from the United States. And from the standpoint of HIV, the complications we used to see from HIV, the complications that led to AIDS, that led to death, simply don't occur now. But what we are seeing is the types of illnesses one would in part just see in a population that has a chronic illness and is able to live for a long period of time, but also for reasons we don't fully understand. Some of the complications that can cause organ failure, renal failure, liver failure, maybe even failure of other organs, seem to be occurring with somewhat more frequency in the HIV-infected population, even if their HIV is in good control. So, as has been stated, end-stage renal disease is a growing problem in the HIV-infected population. An estimate of maybe 5,000 people at the moment who are HIV infected who have end-stage renal disease and do need transplants. End-stage liver disease is also common. And another thing that we've seen is in the HIV-infected patient, and we don't necessarily fully understand this, organ failure may essentially progress more rapidly. And the outcomes of having end-stage renal disease or kidney failure may actually be somewhat worse than in a person who's not HIV infected. We don't understand necessarily why that is, but it does seem to be occurring. I think that emphasizes in my mind the importance of this bill to make it possible for our HIV-infected patients to be able to receive transplants from other HIV-infected patients. Now, as an HIV practitioner, there is something that could be of concern, but I actually think it's not a major concern. Back when we didn't understand AIDS and HIV infection very well, I fully understand the reason for the ban on organ transplant. Even today, people might raise a concern, well, if you transplant an organ from an HIV-infected person to another HIV-infected person, is there any reason that that would cause additional problems with their HIV infection? One possible problem, which has been called superinfection, which I think is a poor word, or at least the super should be considered the same kind of super and superseding, is that an infection in the organ, the particular virus in one patient might be slightly different from the virus in another patient. Years ago, that would be particularly problematic. Today, our medications are such, I don't think that's terribly problematic. Our medications are quite capable of treating almost any virus that anyone would have at the moment in this country. And there are ways to screen in regard for people who have either not been treated or more commonly treated for a long period of time and really have no evidence of developing a changed virus, where that would be completely safe. And that is the majority of HIV-infected patients. I am very much from the HIV community. I'm a member of the board of the HIV-MA. We are an organization that represents HIV clinicians and HIV researchers around this country. The HIV-MA that I represent, and pretty much every other HIV organization that I know of, is supportive of the removal of the ban on organ transplant from HIV-infected patients. It is heartbreaking to me to have a patient, and I do, with end-stage renal disease or maybe end-stage liver disease that I either can't get on the transplant list or who have a disease that I know is going to march along fairly quickly as they wait for a transplant, when in fact the changing of this law could make more organs available. Thank you.